Did you know cognitive behavioral therapy isn't just for anxiety and depression? It can also help people with dementia manage stress, emotions, and daily challenges. Let's explore how. Dementia affects memory, emotions, and behavior, making daily life overwhelming for both patients and caregivers. Cognitive behavioral therapy is a structured therapy that helps reduce anxiety and depression in dementia patients, improve coping strategies for memory loss and confusion, and help caregivers respond to emotional distress effectively. CBT works by reframing negative thoughts and encouraging positive coping mechanisms. For example, if a dementia patient feels frustrated about forgetting names, CBT helps shift their mindset from "I'm losing everything" to "I can still enjoy the moment." But how do we apply CBT in real life? Keep watching to learn simple techniques. CBT for dementia care focuses on managing emotions, not restoring lost memory. Here's how caregivers and patients can use it. Cognitive reframing. Instead of saying "I always forget things," shift to "I sometimes remember" with reminders. Caregivers can use gentle corrections and positive reinforcement instead of focusing on mistakes. Behavioral techniques. Routine building. Sticking to structured daily activities reduces confusion and anxiety. Distraction strategies. If frustration arises, redirect attention to a comforting task like music or a favorite hobby. Relaxation techniques. Breathing exercises and guided imagery help lower agitation and stress. CBT doesn't cure dementia, but it makes life easier, calmer, and more manageable for both the patient and caregiver. CBT is a powerful tool in dementia care. By reframing negative thoughts, creating routines, and using relaxation techniques, we can improve emotional well-being for both patients and caregivers. Want to see real-life CBT techniques in action? My upcoming shorts will break them down step by step. Subscribe now and hit the notification bell so you don't miss them. If this video helped you, like, share, and comment. What's the biggest challenge you face in dementia care? Let's discuss below. For more mental health and caregiving tips, check out my channel. Thank you for watching.